Hey everyone, welcome back to the channel. Today we're talking about something that affects over 1 billion people worldwide, something that could be silently damaging your heart, brain, and kidneys. And the scariest part, you probably don't even know you have it. It's called hypertension, or high blood pressure, and it's not just an old person problem. It's hitting younger people, busy professionals, even fitness enthusiasts, and if we don't talk about it, it could cost us our lives. So today, I'm breaking down everything you need to know, what it is, how to spot it, how to stop it, in plain, simple terms. No jargon, no fluff, just real talk. And stick around till the end. I've got 5 life-saving tips that most doctors don't tell you. Let's start with the basics. Blood pressure is the force of your blood pushing against the walls of your arteries as your heart pumps. Think of it like water flowing through a garden hose. When that pressure is too high for too long, boom, that's hypertension. It's like turning your garden hose up to max and leaving it on 24/7. Eventually, something's gonna burst. Blood pressure is measured in 2 numbers. Systolic, that's the top number, when your heart beats. Diastolic, the bottom number, when your heart rests between beats. Normal is 120/80. If it's consistently 130/80 or higher, that's high blood pressure. And if it hits 140/90 or more, that's stage 2 hypertension, and it's time to act. And no, squeezing your hand really hard before the test won't help. I've seen people try. It doesn't work. So now what are the symptoms of hypertension? Here's the scary truth. Hypertension has no symptoms. You won't feel dizzy. You won't get headaches. You won't suddenly feel off. You could be reading this, feeling perfectly fine, and still have dangerously high blood pressure. That's why it's called the silent killer. It damages your body quietly, year after year, until one day, bam, a stroke, a heart attack, kidney failure attacks. Here is a real story of hypertension. Someone may tell you, I was 45, worked out, ate salads, never smoked. Then one day, I collapsed at work. Turns out my blood pressure was 190/110. I had no idea. This happens every single day. That's why checking your blood pressure isn't optional, it's essential. Just a few people with high blood pressure may have headaches, shortness of breath, nosebleeds. However, these symptoms aren't specific. They usually don't occur until high blood pressure has reached a severe or life-threatening stage. There are 2 main types, and knowing the difference matters. The first type is primary or essential hypertension. This is the most common, about 90 to 95% of cases. This type describes hypertension with no obvious cause. It develops slowly over years, usually from a mix of lifestyle, genetics, and aging. Then there's secondary hypertension, which is caused by another condition. Examples include kidney disease, thyroid problems, sleep apnea, and certain medications, like birth control pills or decongestants. If your blood pressure spikes suddenly, especially if you're young, your doctor will check for these hidden causes. Let's play a quick game. Are you at risk? Do you have a family history of high blood pressure? You're more likely to develop high blood pressure if you have a parent or sibling with the condition. Are you over 45 if you are a man or over 55 if you are a woman? The risk of high blood pressure increases with age, making it more likely to develop high blood pressure as you grow older. Do you eat a lot of processed food? Excess weight causes changes in the blood vessels, the kidneys, and other parts of the body. These changes often increase blood pressure. Being overweight or having obesity also raises the risk of heart disease and its risk factors, such as high cholesterol. Don't exercise? Not exercising can cause weight gain, which increases the risk of high blood pressure. Lack of physical activity can also lead to other health issues, such as obesity and heart disease. Are you stressed out all the time? High stress levels can lead to temporary increases in blood pressure. Stress-related habits like eating more, using tobacco, or drinking alcohol can further raise your blood pressure. Do you drink too much alcohol? Excessive alcohol consumption can raise your blood pressure and contribute to other health problems, increasing your risk of hypertension. Do you smoke? Smoking, chewing tobacco, or vaping immediately raises blood pressure for a short while. Tobacco smoking injures blood vessel walls and speeds up the hardening of the arteries. If you smoke, ask your care provider for strategies to help you quit. High blood pressure is particularly common among Black people. Too much salt. A high intake of salt, also known as sodium, causes your body to retain fluid, which increases blood pressure. Reducing sodium can help manage hypertension. Stress. High levels of stress can lead to a temporary increase in blood pressure. Stress-related habits such as eating more, using tobacco, or drinking alcohol can lead to further increases in blood pressure. If you said yes to 2 or more of these risk factors, you're in the danger zone for high blood pressure. It's important to take steps to manage your health. And here's a shocker. Being fit doesn't make you immune. I've seen marathon runners with high BP. Why? It's because of stress, salt, genetics. It's not just about the gym. Great question for you. When should you see a doctor? If you're over 40, then you need annual checkups. If you have a family history, you should start checkups at 18. If you're pregnant, then preeclampsia is real. Take care. If you've had a stroke, heart issue, or kidney problem, then you should monitor it closely. And if your home monitor shows 140/90 or higher on 2 separate days, call your doctor. Don't wait. So now how doctors diagnose hypertension actually. To diagnose high blood pressure, your healthcare provider examines you and asks questions about your medical history and any symptoms. Your provider listens to your heart using a device called a stethoscope. Your blood pressure is checked using a cuff, usually placed around your arm. It's important that the cuff fits. If it's too big or too small, blood pressure readings can vary. The cuff is inflated using a small hand pump or a machine. High blood pressure, hypertension, is diagnosed if the blood pressure reading is equal to or greater than 130/80 millimeters mercury. A diagnosis of high blood pressure is usually based on the average of 2 or more readings taken on separate occasions. Diagnosis isn't one reading. It takes multiple measurements over time because your BP changes throughout the day. Your doctor might say, "Come back in a week," or give you a 24-hour ambulatory monitor, a cuff that checks your BP every 30 minutes even while you sleep. Trust me, it's not fun, but it gives the most accurate picture. They'll also run blood tests, check your urine, maybe an ECG, to see if damage has already started. Let's talk about the worst-case scenarios, because this is real. Uncontrolled high BP can lead to heart attack or stroke, hardening and thickening of the arteries due to high blood pressure or other factors can lead to a heart attack, stroke, or other complications. Aneurysm. Increased blood pressure can cause a blood vessel to weaken and bulge, forming an aneurysm. If an aneurysm ruptures, it can be life-threatening. Heart failure. When you have high blood pressure, the heart has to work harder to pump blood. The strain causes the walls of the heart's pumping chamber to thicken. This condition is called left ventricular hypertrophy. Kidney failure. High blood pressure can cause the blood vessels in the kidneys to become narrow or weak. This can lead to kidney damage. Vision loss. Increased blood pressure can cause thickened, narrowed, or torn blood vessels in the eyes. This can result in vision loss. Dementia. Damaged brain blood flow leads to memory loss. Narrowed or blocked arteries can limit blood flow to the brain. This can cause a certain type of dementia called vascular dementia. A stroke that interrupts blood flow to the brain also can cause vascular dementia. Sexual dysfunction. Poor blood flow affects performance. This isn't fear-mongering. This is science, and it's preventable. Good news. Yes, you can control it, sometimes even reverse it. Treatment has two parts: lifestyle changes, the foundation, and medications when needed. Lifestyle fixes. DASH diet, rich in fruits, veggies, whole grains, low-fat dairy. Cut the salt. Aim for under 1,500 milligrams per day. Exercise, 30 mins a day, 5 days a week. Lose weight, even 5 to 10 pounds helps. Quit smoking, non-negotiable. Limit alcohol, 1 drink a day for women, 2 for men. Manage stress, meditation, yoga, breathing. Medications. The type of medicine used to treat hypertension depends on your overall health and how high your blood pressure is. 2 or more blood pressure drugs often work better than 1. It can take some time to find the medicine or combination of medicines that works best for you. When taking blood pressure medicine, it's important to know your goal blood pressure level. You should aim for a blood pressure treatment goal of less than 130 or 80 millimeters of mercury. But, and this is big, medication is not a free pass to eat junk food. You still need to live healthy. Alright, here are 12 game-changing tips you won't hear in most clinics. Tip 1. Check your BP at home. Pharmacies are great, but home monitors are better. Get an upper arm cuff, not wrist, and log your numbers. Tip 2. Beware of white coat hypertension. Some people's BP spikes only at the doctor's office. Home readings help avoid overtreatment. Tip 3. Eat potassium-rich foods, like bananas, spinach, avocados. Potassium balances sodium and relaxes blood vessels. Tip 4. Sleep apnea is a hidden fill-in. If you snore loudly or wake up tired, get tested. Treating it can drop your BP dramatically. Tip 5. Don't skip meds, even if you feel fine. High BP is like a fire. You can't see the flames, but the damage is real. Tip 6. Lose extra weight and watch your waistline. Weight loss is one of the best ways to control blood pressure. If you're overweight or have obesity, losing even a small amount of weight can help lower blood pressure. Tip 7. Exercise regularly. Regular aerobic exercise can lower high blood pressure by about 5 to 8 millimeters Hg. It's important to keep exercising to keep blood pressure from rising again. Tip 8. Eat a healthy diet. Eating a diet rich in whole grains, fruits, vegetables, and low-fat dairy products and low in saturated fat and cholesterol can lower high blood pressure by up to 11 millimeters of mercury. Examples of eating plans that can help control blood pressure are the dietary approaches to stop hypertension, DASH diet, and the Mediterranean diet. Tip 9. Reduce salt and sodium in your diet. Even a little less sodium in the diet can improve heart health and blood pressure. Sodium's effect on blood pressure varies among groups of people. In general, limit sodium to 2,300 milligrams a day or less. But for most adults, it's ideal to limit sodium to 1,500 milligrams a day or less. Doing that may lower high blood pressure by about 5 to 6 millimeters Hg. To lower sodium in the diet, read food labels. Look for low-sodium versions of foods and drinks. Eat fewer processed foods. Only a small amount of sodium occurs naturally in foods. Most sodium is added during processing. Don't add table salt. Use herbs or spices to add flavor to food. Cook. Cooking lets you control the amount of sodium in the food. Tip 10. Limit alcohol. Limiting alcohol to less than 1 drink a day for women or 2 drinks a day for men can help lower blood pressure by about 4 millimeters Hg. Tip 11. Quit smoking. Smoking raises blood pressure. Stopping smoking helps lower blood pressure. It also can lower the risk of heart disease and improve overall health, possibly leading to a longer life. Tip 12. Ease stress. Long-term stress may play a part in high blood pressure. More research is needed on the effects of stress reduction techniques to find out whether they can lower blood pressure. but it can't hurt to figure out what causes stress, such as work, family, finances, or illness. Once you know the causes of your stress, you can find ways to take charge of them. Tip 12. Control your cholesterol and blood sugar. High blood sugar and high levels of bad non-HDL cholesterol raise the risk of heart disease. To help manage cholesterol and blood sugar, try some of the same healthy habits that help lower blood pressure. Eat healthy, get exercise, lose extra weight, and don't smoke. Follow your healthcare professional's advice on how to manage cholesterol and blood sugar. Look, I get it. Life is busy. But your health, that's everything. You can't pour from an empty cup. Take 5 minutes today. Check your BP. Talk to your doctor. Share this video with someone you love, because they might not know they're at risk. If this video helped you, smash that like button, subscribe, and share it, because awareness saves lives.